I'm sure people listening can understand when you are used to being the one who's responsible for your family, who's used to making important decisions, leading the way. It's really humbling to need help yourself. I have always helped others without judgment, and yet I felt ashamed for needing help when I needed it. And I think that's pretty common, especially when you're a really driven person. So it was an important lesson in humility for me to just ground myself even more and think, who are the people in my life who can help me, who care for me, and who can I tap into to get through this?
Hi, I'm Glennis Woods Mullins, and I love to help women to vibe, to be more vibrant, intuitive, beautiful, and empowered in midlife. So come on, let's vibe. A few years ago, this country went through a very traumatic experience. We experienced COVID and the pandemic and everything that went along with it. And there were some of us that walked away with, at least on surface level, unscathed and whole. And there's others who contracted COVID and didn't walk away unscathed and have issues and concerns that they're dealing with. A lot of people call it long COVID. And today we have with us Dr. Zeest Khan. She is a Stanford-trained anesthesiologist who specializes in open heart surgery. She developed long COVID after working on the front lines of the pandemic in 2020 and was bedbound for nearly a year. She thought her doctors would help her, but they were confused too. This was so new to everyone. And so she started approaching her own health, the way she cared for her complex and critically ill patients, and in the operating room by making one scary decision at a time. And she's here with us today. And first of all, I'm so honored that you're here. I'm so glad that you're here and whole and looking beautiful. Welcome to the V.I.B.E Living Podcast. It's wonderful to have you here, Dr. Khan.
Thank you so much for having me. I'm so pleased to meet you and get to talk with you today.
Absolutely. So many questions I want to ask you, but the first question is, you went from leading cardiac surgery and running a practice to needing help to get out of bed. What was emotionally the hardest about that transition?
Oh gosh, a lot. And I'm sure people listening can understand when you are used to being the one who's responsible for your family, who's used to making important decisions, leading the way. It's really humbling to need help yourself. I have always helped others without judgment, and yet I felt ashamed for needing help when I needed it. And I think that's pretty common, especially when you're a really driven person. So it was an important lesson in humility for me to just ground myself even more and think, who are the people in my life who can help me, who care for me, and who can I tap into to get through this?
It's so interesting because you have been in a role of caretaking of critically ill patients and being right there in the operating room, making major decisions. What did you learn about being on the other side of that, of being a critically ill patient? How has that impacted you in terms of your practice right now?
Yeah, it's such a good question because my perspective on medicine has really changed or maybe evolved. I have always been involved in healthcare on the patient side, typically as an advocate for family members. I was always that person who was translating what doctor's notes meant. People would call me and be like, I'm going through this. What do you think? But when I actually became the patient, it was eye-opening that these doctors' visits are really intimidating. There's a power hierarchy there that happens even if you as a patient look exactly the same as your doctor in the white coat. But when we tack on those demographic differences that you know about, that power differential gets even wider. And I found myself really surprised at how much I had to perform for my doctor, or at least I perceived like I had to perform for my doctor in order to look believable, in order to be like, oh, you know what? I'm not exaggerating. This is something that's real. Can you help me? And this part of medicine is something that I did not appreciate as much, just how powerful that intimidation and power differential is in delivery of healthcare. And since I've been ill and connecting with so many other patients, I'm hearing the same stories over and over again. It wasn't just me.
As an advocate for women over 40, from a holistic perspective, this is one of the main issues, and that is feeling like their symptoms are being minimized or being placated by saying you're just aging. It's not a big deal. And so I understand exactly what you are saying. Share with us, what were some of the symptoms that you began experiencing after you were cured of COVID?
Yeah, I'll talk about how I recognized my long COVID symptoms and what happened in 2020. The pandemic swept. I live in an area that was really heavily impacted by COVID. If you guys remember those maps that were drawn, they were color coded of which areas and counties were hardest hit. We were red from the day those maps were created to the day they stopped being published. So there were outcroppings or outbreaks of COVID, not only in our community, but among our hospital staff as well. And in the spring of 2020, in the kind of heat of everything happening, we got a lot of patients. I'm an anesthesiologist, so I am in people's airways in really dynamic situations. So I had a high exposure risk. I started feeling just terrible. I thought I had maybe a sinus infection. And what happened was I didn't recover from that. We didn't have tests readily available in the spring of 2020. If you remember, they were just being developed and when they were only used in inpatient settings. And so I didn't have a way of being diagnosed. And there's a lot of people with long COVID who are like me. We don't have a test that's positive. Even today, people who get COVID pretty infrequently test for it or have a documented diagnosis. But as the year progressed, I got more and more tired. And I was really active. And I started, I really realized something was wrong when I had to sit in my car in the parking lot of the hospital and give myself a pep talk just to get to the front door of the hospital, to walk that far. I had to give myself a pep talk to stand up from my chair. I started taking the elevator one flight of stairs because I couldn't go up, walk a flight of stairs anymore. I was just progressively fatigued. And initially, like a lot of women, I minimized my own symptoms. It's stressful. I'm working a lot. I'm not sleeping well. And part of the reason I wasn't sleeping well wasn't just stress, but because my respiratory symptoms were out of control. I suddenly had debilitating asthma and it really interrupted my life. So I wasn't sleeping. I was working crazy hours. And it was really easy for me to dismiss this creeping fatigue and just inability to function the way I was before. So one day in March of 2021, it got so bad that I left my hospital shift and I couldn't make it to my car. I collapsed on a little grassy patch in front of the hospital. I found a lovely little tree that I will always appreciate that I was able to lean up against until I found help to get me to my car. I literally had no physical energy to walk anymore. I got home eventually and I thought I would just take a little break. I just needed to recover. I was still not wanting to admit that something was really wrong. And March of 2021 was the last time I practiced anesthesia in a hospital. Since then, I have been a full-time patient, as I say. My medical business was called Zeest Khan MD. I now refer to myself as long COVID MD. I try to help other people with this because I'm still a doctor, and we can talk about how our identity changes from circumstances. But that part of me that wants to serve and help people is still there. It just has to be in a very different way.
Wow, what a sobering story, and so many questions around the whole fact of just developing the long COVID. I first want to ask you, what should a patient do if they feel that they have developed long COVID? Where do they go?
Yeah, it's also a good question. So, long COVID is the colloquial term. It's what most people use to refer to this chronic post viral illness. So, chronic means it lasts a long time. Post viral means it happens after an infection. Conditions like long COVID are not new. And that's something I had to learn as a patient because I didn't learn about this in medical school or in my medical training or even in my practice. Post infectious conditions, so you get an infection, and after that acute part resolves, your cold symptoms get better, your fever subsides. Some people develop this long lasting condition that's marked oftentimes by fatigue, but it also really can impact your nervous system and make your heart rate and blood pressure act in a way it's not typically meant to act. So people can get dizzy. They have a hard time standing up. Sometimes they have a hard time just staying upright. This fatigue, as I was saying, this cognitive injury that people refer to as brain fog, but it's really like a concussion or has similarities to a post-stroke situation. People with post-infectious conditions can have all sorts of symptoms or a combination of symptoms. So what I recommend to people is to believe yourself, first of all. Pay attention and take time for yourself to find answers. That can be a hard process itself. And I'm sure women have lots of things that they're doing. We can't completely apply it to everyone. But in general, women have a lot going on. And we think about ourselves last a lot of the time. So my first advice is put yourself first here. Take this seriously, carve out time, and start paying attention to what your body is telling you. I recommend that because if you can pay attention to what your body is telling you, then you can communicate that to your doctor, and you should. But when you can pay attention to what you're experiencing and how that is impacting you, how that's getting in the way of doing what you need to do, you can then bring that to your doctor and start finding some solutions.
We will return to our great conversation with Dr. Khan right after this message. Let me ask you, how often are you dealing with congestion, sinus pressure, or allergies and just pushing through it? If that's you, I want to share something that really made a difference for me. It's called Sonu, a drug-free, FDA-approved therapy that uses personalized sound waves to help open your nasal passages. What makes it unique is that the sound waves are custom tuned to your facial structure. So it's designed especially for you. When I started using it, I noticed a real shift, especially with that stuffy nose I used to wake up with every morning. It actually helped me breathe clearly again. Those gentle vibrations work through your sinus cavities too, calming inflammation, reducing congestion, and supporting natural airflow. And it even works with your nervous system to reduce swelling. No medication needed. If you want to check it out for yourself, click the link on my show page to learn more. I find it interesting because it also sounds from your experience that you may have had some challenges in terms of just communicating to the doctors what the symptoms were and getting them to take it seriously. Why do we seem to have that problem with doctors? Why do they seem to get so frustrated with chronically ill patients? And why do some patients walk away feeling like they're being gaslit, not believed? What's going on there?
It's also a very good question, a very important issue, and I've given it a lot of thought. I think there's a few things at play. One is we as a society and we as physicians don't know a lot of terminology for post viral conditions. It's not something that we talk about a lot. It's not, as a doctor, I'll say, it's not something we learn about very much. And so it becomes really hard to recognize as a problem. So that's the first thing. The second thing is, and I've had conversations with other doctors on my podcast and Substack platform that goes by the name of Long COVID MD, where we talk about the nature of our medical training. As little baby doctors, we get punished publicly when we don't know something. It is trial by fire, and the stakes feel really high. It's very much a shame based learning technique that occurs in the later part of medical school and throughout our medical residencies. Different places will have it to varying degrees, but this is typically tradition. And so when you are imprinted with fear of saying, I don't know, it becomes really hard later on to say to a patient, I don't know. And I think there is this gut instinct or gut response among a lot of doctors who may not even realize that they have this experience influencing them. It's a fear of admitting that they don't know. They also worry that if I admit to my patient I don't know, they're not going to trust me. And what I'm trying to do is to communicate to other doctors like me that perhaps that was true at some point. I doubt it really was. But today, it actually builds trust with your patient if you can admit, I don't know, but I'm going to look into this for you.
Yes,
I'm
I
going to
think
collaborate.
I absolutely agree with you. I encourage my clients to look at their relationship with their doctors as a hand in glove fit, having two-way conversations, not just going into the doctor's office and you sit and they lecture to you about what's wrong, but you go in there with your spiral notebook or your journal, talking about all the symptoms and everything, discuss that, and in the hopes that they hear you. And if they don't have immediate answers, because I don't think most women in particular think that the doctor's going to have an immediate answer, but they at least want to know that it's something they can work on together to figure out a solution. Because the reality is that every single human being on this planet is different. Our DNA is different. So the generalities and the averages and the broad strokes medicine that we have a tendency to practice here in the United States does not always work for everyone. There's always going to be that exception, okay, that needs something else. And the reality is, especially women, we're all different because we're so intricate. So given all of that, how does a patient talk with their doctor to get them to hear what's really going on? How do they break that barrier of being afraid to speak out and to say, I don't really know?
I get asked this question a lot because it's so important. And you know as well as I do, unfortunately, you don't have control about over what someone else, how someone else is going to act. But what we can do as patients is really understand how healthcare works, because I think a lot of patients don't understand how the system is structured. And what I mean by that is if you can understand a little bit more about what the role of a primary care doctor is, what their scope of practice is, and how specialists approach their own scope of practice, it can remove some of that disappointment. So I'll say that there's a few things to keep in mind. One, you are the expert in your body, and physicians or other members of your healthcare team are experts in medical science. And if we can bring those two things together, that's a recipe for success. But it's not always there. Right now, primary care doctors in particular are under massive strains. They have limited time with their patients. They have tight oversight. Excuse me. They have tight oversight by their bosses. Very few doctors are now private practice, have their own practice. They have to answer to business people with MBAs who are separated from clinical care. And now we've got computers in every room that we as doctors have to answer to. And it's burdensome. That's right. You're like typing and looking and even maintaining eye contact. That's a disruption to that relationship.
I understand this on a very personal level because I worked for a managed care system on the administrative side in charge of physician recruitment and nurse recruitment for 6 hospitals, 15 clinics. And one of the biggest pushbacks initially when we went online, and this was about 20 years ago when we first went online, a major managed care company, they were pushing back saying, how are we going to be able to connect with our patients? There was a concern there, a real concern. And I don't want people to think that many doctors do not, it's not that they don't care. So much of it has to do with their protocols and the goals and what I call the butts and beds philosophy and everything else. There's so many things going on from an administrative, quite frankly, for-profit level that have nothing to do with the care they want to extend. And I would imagine over time, you begin to almost become insensitive for just to be able to survive a system like that as a doctor. So many times it's not even personal. It's just a matter of survival. So given that, how can patients begin to build a better partnership with their doctors, especially when there's no clear treatment roadmap?
Yeah, patients have real concerns about the way our healthcare system is structured, and so do doctors. It's really in a difficult period right now. So what I recommend to optimize this is to think about your relationship with your doctor as a relationship. When you first come to your doctor with complex complaints, a brand new situation, expect that this is going to be a piecemeal approach. What has worked for me as an anesthesiologist in really critical circumstances, I have taken care of a lot of trauma patients who come in injured, and it's a dynamic situation. Things are changing moment to moment. And I have to make really critical decisions very quickly. 2 or 3 things can be happening at once, but I am one person and I have to prioritize what I'm going to do in order. And so if you as a patient have multiple symptoms crop up, I think it's helpful to think about these different symptoms and to ask yourself, what is the most disruptive symptom right now? Because this could be an opportunity to focus your attention. It's important to bring all of your symptoms to your doctor, but because these appointments are so short, sometimes we have the opportunity to only tackle one thing at a time. And that still works. If you can get that low-lying fruit and improve your quality of life while you continue to search for answers. And also, unfortunately, a lot of people with long COVID have to make really big lifestyle changes and really hard decisions about how they're going to change their work and their life structure. So it gives you some bandwidth if you can tackle, say, your asthma and then get that under control. So you're breathing better, you're sleeping better. And then you can start talking about the tingling in your fingers. Now that I'm breathing a little better, let's spend a little bit more time on this. Healthcare as is structured by organ systems. It is not detached, but it's a systems-based system. So you've got a cardiologist who is an expert in the heart, a pulmonologist who's an expert in the lungs. But as someone who takes care of heart and lung patients, those two things are very connected. Those two things are very connected to your brain. They're connected to your kidneys. They're connected to your gut. So when you have symptoms that affect multiple organ systems, we still don't have a home in medicine for something like long COVID. And so expect as a patient that you're going to be talking to multiple people. And then I hope for everyone to have a home base, which could be your primary care doctor, to check in with regularly and be like, I got this input from multiple sources. Can you help me sift through this? And that could be a very helpful use of a doctor's appointment.
What helped you emotionally during the darkest part of your recovery, doctor?
Linus, I have taken care of the most ill people in the world. I have seen people struggle. I have seen people lose their life. I have seen people recover. And I keep coming back to my body is not that much different from yours. And if you could do it, if my patients have been able to do it, or at least put in effort, then I can too. So I tap into that life force or that energy force of the suffering that all humans experience. And I try to keep that perspective because it is very reasonable and warranted to ask, why did this happen to me? But at some point, you have to let that go because it doesn't help you move forward. Why wouldn't it happen to me? I have a body that's vulnerable just like everyone else's. And I'm very sad that I've lost the type of career that I spent so long investing in, training to do, and practicing. But recently it clicked for me that I got to do that. Maybe if I think about it as, oh, I lost, instead of saying I lost that, focus more. I was pretty lucky I got to do such cool things. What is next for me? Because I really had to think about who am I, like a lot of people with sudden illness have to do. What is important to me? Where do I want to use my energy, spend my energy, even especially since it's so limited? And for me, it was finding answers, engaging with my family, my husband and my children. And now, of course, it's again serving people and being a doctor in a different way. And your listeners know we women, we have to reinvent ourselves.
Yes, that's right. We are resilient. And reinvention, I think we created that word. That is definitely something that we have to do. And when you take a look at the whole journey that you've been on, what gives you hope right now for yourself and for other people who are struggling with the after symptoms of having suffered from whatever the virus might have been? You used the term, it was called post-virus.
Post-viral chronic illness.
Yes. What kind of hope can they have for people who are suffering from post-viral chronic illness?
I have seen over the last few years an increased awareness and understanding of long COVID and post-viral conditions by physicians and the medical community, by researchers, and by society as a whole. I am so happy, if there is a silver lining, that I got ill in the time of the internet, because patients, we connect to one another online because many times we're stuck in our homes. It's very hard to get out and socialize and meet people. A lot of us are very worried about getting sick again, and we can't afford to get sick again. So going out is really limited because COVID is still around. There's still a risk of another viral infection setting us back even more. So I am really excited about the increased awareness of long COVID, the continued research, both by federally funded projects and private entities. I talk a lot about the research and the structure of research on my podcast and Substack. And I'm I get a lot of encouragement from other people in the long COVID space. This is a terrible club to be a part of, but there's some really cool, amazing, remarkable people in it. And so I'm always happy to meet someone else. I wouldn't have met you if didn't happen to me. And if you think this is the last time we're going to talk, that's not.
No,
You can get that out of your head because I'm already
there's
putting you on my friends list.
there's a connection here that I'm feeling. There's an energetic connection. And I'm just wondering because I know that women going to hear this. I always say that I used to say when I first got started doing these podcasts about 15 years ago, if there's one person hears, it's going to make a difference. But I know now, since we're the top 5% in the world, that more than one person is going to hear. But if there's a woman out there listening today who's feeling exhausted, unseen, and discouraged by her health journey, what would you want her to remember?
Such a good question. And I don't know if I have all of the wisdom to give great advice, but what has worked for me is to demand time for myself and to recognize that is not, optional. It's vital to my survival and for everybody who is connected to me and dependent on me. There is research that demonstrates that women actually negotiate harder and more effectively when they keep their loved ones in mind or they identify who they're negotiating on behalf of. That might show a problem, but it's also a strength for us that we think about community moving forward. So
it's our superpower.
Yeah.
We take some of that superpower and apply it to ourselves as well.
Yes.
So that we can continue to advocate for everyone else and look at it that way. Doctor, thank you so much for being on the V.I.B.E Living podcast. Such a powerful testimony. It's been wonderful having you here today.
Thank you for having me. It's so nice to meet you.
Great to meet you as well. And great that all of you have taken time to listen to this podcast. I cannot tell you how much I appreciate the fact that you've been liking and subscribing and sending comments about the wonderful wellness and health experts that we have had here, because it's all about your mind, body, spirit wellness as you age. And I really truly do believe that as we age, we don't necessarily have to be sick. Just because you're getting older doesn't mean that you have to be sick. All you want to do is figure out the things that you need to be more vibrant, more intuitive, more beautiful. That's the inner beauty radiating out, and also empowered to live that V.I.B.E life. Thanks so much, everyone, for listening. Have a fantastic day. And don't forget to V.I.B E. Bye-bye, everybody. Thanks for listening to the V.I.B.E Living Podcast. And don't forget to subscribe, like, and comment, and share this podcast. Have a fantastic day, and don't forget to V.I.B E. Bye-bye, everybody.